Hello and welcome to Effective Skin Analysis. This is one of the most important parts of your skin treatment. Once your client has filled in the intake form and you have ascertained that she is indeed or he is indeed a candidate for the treatment, you need to know what medications they are taking, any past history of illness, medications, or present illnesses and medications that may inhibit, restrict, or they may not be a candidate for the service you're giving today. You also need to know what products they are using. Brand is important, but more than brand, you need to know what type of cleansers, toners, exfoliants they're using, because we really need to know the active ingredients. And again, if there's anything that may inhibit or restrict, or they may not be a candidate for the service today. Once you have that information, after your second thorough cleansing of the face, neck, and décolleté, you will start the skin analysis. And we will make sure that we know exactly the client's needs of the skin and what she would like to change about her skin. We are performing skin analysis. I'm using a magnifying lamp, which will help me identify. We do not diagnose any diseases or disorders, but we do identify them so that we can talk to the client about her home needs, customize the treatment today, and see what future treatments she may need. It's important to use a magnifying lamp so that you can see the skin effectively. You can also protect yourself and the client when you're doing extractions. iPads are not necessarily that important. The light will not hurt the eyes. I use iPads for more comfort than anything else. But when I do the skin analysis, I make sure that I lift the iPad so that I can see right round the orbital area for that effective skin analysis. Right, the first thing I do when I do skin analysis is I look at the skin. And remember, when your client is on the table, it is no longer her face, it is your face. So therefore, you own the client's face, so you can move the head from where you want it to be. You do not have to try and do some sort of Cirque du Soleil contortion. You can look at the skin and analyze effectively. So the first thing we do is look, touch, and feel the skin. So I need to ask my client what she would like to change about your skin. What would you like to change about your skin?
Some of the pigment colors.
Okay, so her main concern is hyperpigmentation. So I am going to focus on hyperpigmentation, even though I'm going to identify other disorders I may see. I'm going to identify her skin type, her skin condition, and anything else I may see. So I'm going to go ahead and touch her skin. I'm going to move her head to the side. I like to look behind the ears. I'm going to lift. And I'm going to, first thing I'm going to do is I'm going to compliment the client. When you're doing skin analysis, it's very important to make the client feel good about themselves and the process that you are about to begin. There has to be something good that you can find about the client's skin today. And what I really like about my client's skin is the texture. She has a beautiful smooth texture, and I know my client comes for regular chemical peels, laser treatments, and microdermabrasion. So she has a beautiful texture. When I do the elasticity I would say is good to fair, could be a little better. And then when I lift the skin, I do see that there is a slight dehydration. So that says to me that perhaps she's not drinking enough water, or maybe she drinks a lot of coffee. We'll ask her about her consumption. Also, perhaps she needs a serum or a moisturizer to help with that natural moisturizing factor so that we can get some more moisture into her skin. So when I look at her skin and I look at, she is a combination skin, but she is dehydrated. So I would go ahead and pick up my chart and I would write on the chart as I'm analyzing the skin and asking her questions. Right. What I see on her skin is comedones on the nose area, telangiectasias or cupros round the sides of the nose, so that's a little bit of sensitivity. She is somebody that has a lot of red in undertones, and there is some heat in the tissue. So that tells me that she may have some mild rosacea, but definitely has some diffuse redness in the skin. She has hyperpigmentation on her cheekbones on both sides. So I'm going to go ahead and mark that on the chart and discuss with her using vitamin C serums at home, using brightness and lightness at home in the form of creams and serums, as far as tyrosinase inhibitors and ingredients like arbutin, mulberry, kojic acid, like our Brighten Me line in the Elaine Sterling Skincare. When I look at, she has fine lines on her forehead. Good. So what I'm going to focus on today in the treatment is the hyperpigmentation and the dehydration. And I'm going to recommend for her future use is to come for oxygen treatments and microdermabrasion, and to be using the Brighten Me and the vitamin C at home. So we're going to customize the treatment today. We will not be doing any steam on this client because of the heat in the tissue as well as the diffuse redness. We will be doing extractions on the nose. It will be a very mild exfoliation because we do not want to irritate the skin. And we will be using a mask today that is hydrated. So we have, the first thing we do, let's recap with skin analysis, is we touch, feel, and look at the entire face and behind the ear. We ask the client what they would like to change. We then identify skin disorders, skin type, skin condition, dehydration, elasticity. We then go ahead and discuss future treatments and home care, corrective and supportive home care, and then we customize our service today according to the skin analysis. And then the products that I discussed with her, we go ahead and write on the prescription pad so that at the end of the service, basically when I have removed the mask and added the SPF, we discuss again the needs of the skin for home care, supportive and corrective home care, as well as going ahead and discussing when she needs to come back, what future services she needs, because in order to deal with the hyperpigmentation, we need to see her in a series of, I feel, vitamin C peels, microdermabrasion, and oxygen treatments. And that concludes effective skin analysis.